So, Rebecca, welcome back to the clinic today.
Thank you.
How are you feeling?
Good.
Good. Finally ready for your procedure?
Yes.
I know it's exciting after all the time that you wait. You kind of think about it, but what was the biggest reason that you chose to have liposuction today?
There's just some areas on my body that no matter what I do with diet or exercise after having my kids, that I just have problems losing the weight there or getting rid of the fat.
Yeah, I think that for women, they hit a certain point, especially after having children, that because of hormones or whatever, their body does change, and there's certain areas that really do become truly resistant to diet and exercise. Or when you finally do take off weight or lose 5 or 6 pounds, it just doesn't come off in the areas that you want it to come off. So that's the reason that most people end up choosing liposuction. So once we bring those areas back into proportion, then as your body goes up and down in weight, you're going to feel much more comfortable in your own skin. So we take off the little fat pads, which we'll look at here in a second, and we'll kind of go over that. Okay? But you'll do just fine, okay?
Okay, thank you.
One of your biggest concerns was the fact that you've had some children, and we have a little bit of floppy skin here. Actually, you have some stretch marks on your skin, but overall the integrity of your skin is pretty good. It's even holding up the fat that you have right now. So after lipo, this is probably one of the most common questions that I get asked by women is, what's going to happen to my skin, and do I need a tummy tuck, or do I need lipo, or do I need both? You know, with lipo, we certainly can't get rid of the stretch marks. If that was the case, then I would tell any woman that yes, if you're willing to accept a scar all the way across here, and your belly button being cut out and replaced, they can get rid of the scars and they can pull your belly totally tight. But with lipo alone, and I think you've seen from some of my previous examples or previous patients, with just thorough lipo, the way that we do it here and the way I've always done it, we create hundreds and thousands of tiny little tunnels across the belly, really creating a good environment for skin retraction. Sometimes, if necessary, I'll even use certain modalities like ultrasonic assisted liposuction or laser assisted liposuction if I think that we need that as well. In your case, since it's what we call virgin lipo, it's never been touched before, it should be fine with just very fine-tuned lipo, very small instrument. And your skin will just be a much smaller version of it as it is now. And we'll see that later on, 2 or 3 months later, when we look at your after shots. Okay? All right, so let's carefully outline here what we're going to do. Of course, women can get by with being a little larger down here in the buttocks, but one place that all women hate having fat is in the waistline.
Yeah.
So we really want to carve this out and cinch this waistline as much as possible. So you can see these are where the incisions are going to be. 2 low, 2 on the sides, and then 1 up here. And that allows me to do something very important as well. Traditional surgical approach to liposuction, a lot of doctors still do it that way, and that's their preference, of course. They'll just make 1 incision down here, 2 down here, and then hit the abdomen from maybe 1 or 2 angles. The reason that I like to hit things from 4 or 5, sometimes 6 different angles is, again, that skin tightening that it creates. We have to hit the abdominal cavity through multiple angles, multiple vectors, constantly crisscrossing and crosshatching, forming a whole network of little tunnels underneath the skin, which causes us to get good skin retraction in all different angles. Okay? First thing that we're going to do is we're going to make our tiny little incision points, and then we're going to start filling you up with the local anesthesia. Okay? And this is all the bigger your incision sites will be. Never do we use a scalpel or cut you open. We always work through tiny little incision ports. All right. Now we're going to start putting in the anesthesia. So during this part, this is the part, it does pinch just a little bit when you put it in, kind of like going to the dentist when they put in local anesthesia, but you'll get used to it very, very quickly, okay? And the skin kind of turns white during this portion too, because we also put a medication in there to tell the blood vessels to kind of shut down. So there's really minimal, just as we talked about during your consult, minimal amount of bleeding during this part of the procedure. So now we're going to start the suctioning process, and it's kind of the same sensation as putting in the anesthesia. Really nothing exciting. It just takes a little while to accurately take the fat out. Move around during the procedure and hit it start taking the fat out from all of the access points so that we get that skin to tighten up as much as possible. We've already removed about 1.5 liters, and you can see how the abdomen has already came down substantially, and the skin is tightening up as we speak. Stretch marks are becoming less pronounced because they're not stretched out so much. The skin starts to come together, they become less noticeable. But already we're getting a wonderful amount of skin retraction in this area. We still haven't really addressed the pubic area yet. You can see the mound still left here in the pubic area. And that's what I wanted to point out, that this is a common area that's really not addressed enough with abdominal liposuction. Almost always I'll address it or talk to the patient about addressing this area, because once we take down the abdomen fully, and you'll see that at the end, we're going to have an abdomen that's fairly flat and without fatty tissue. If we left behind this will really have an upset patient on our hands later on, because it'll be a definitive bulge when they wear a tighter fitting dress or more revealing clothing or a bathing suit. So that's why I like to have that, bring it down and address it early on. Patients ask me all the time, I've been doing liposuction for 10 years, and they say, well, Dr. Hall, why can't you, or why won't you put me totally out and anesthetize me so that I'm asleep? But one of the key reasons that we get extremely good and reproducible results in this clinic is because we have an awake patient. So we have someone that has muscle tone, so that we can see the fat on top of the muscle and feel that nice firm muscle. When I'm doing an abdomen, it's almost imperative when I get to this stage that I'll have my patients do a little crunch so I can see what fat is left behind. So I'm going to have you tighten up your abdominal muscles. There we go. When we do that, you can see the fat level. You can see that it's an incomplete liposuction at this stage. Now relax down. When she relaxes down, it looks much more flat. It looks like we perhaps are done with the procedure. But again, what we would have is more often than not an unhappy patient later on that comes back and says, well, you left behind this fat here. I like to be as thorough as possible when I do liposuction. And the way I learned liposuction from Dr. Jeff Klein with the tumescent technique is to do it entirely under local anesthesia, so we have these advantages. So, how do you feel?
I feel great.
We took off, I think, a little over 3 liters total, so it was just a really good case. You're just going to be super happy with the results. I can already tell. All the tissue is a little bit waterlogged now and stuff, but so overall, do you think it was easier than you thought it would be?
Absolutely. A lot easier.
It's normal. I certainly understand. People get a little bit excited and they're apprehensive when you're doing something under local, but we've done this enough that we really, really try to put people at ease, and once they get about a half an hour into the procedure, most of them generally do pretty well. You did spectacular. So congratulations, and I'm going to bring you back in about a week. We'll do a follow-up. We'll just take a look, give you a chance to ask any questions, look at the incision sites. My post-operative instructions are very simple for people. I'm just going to have you wear your compression garment. My nurse will put on you here shortly. You'll wear that for about 7 to 10 days after the procedure. And then I'll see you for your follow-up, and we'll probably take it off at that point and let you keep it off. And then I'll see you back in about 3 months, and we're going to take your post-operative video as well, and then we'll go from there.
Okay.
All right.
Thank you.
Congratulations.